computer audio. All right. Can anyone hear me? You can give me a thumbs up if you can hear me, or you can just say, I can hear you. Maybe. Let's see. My sound off? No.
We can hear you.
All right. Can anyone hear me now? Can you hear me? Give me a thumbs up or say, yes, I can hear you.
I can hear you.
No?
Oh.
Anybody? Okay. Thank you. All right.
But you can't hear me?
Put your name in the chat so I know that you are here. We'll wait a minute or two. Hopefully a few other people will show up. I'm hoping they're not all traveling for Thanksgiving. All right.
Can you hear me?
Okay. Thank you, Lupe.
Can you hear me at all?
I can't hear anybody. Hold on. What's going on here? All right. I'm hoping that works.
Can you hear me?
I can now. I must have had mute on or something. All right. Put names in the chat. And I'm stalling because there's only 4 or 5 people. So, but it could be only a few people show up. Do you have a question?
Yes. Did you get my email?
When was it?
A few days ago. I missed one of the last times we met for lab. I missed it because I was having symptoms, and so I was waiting for my results to come back. I don't have the leg muscle assignment.
Oh, okay.
Can you email it to me, or?
I will see what I can do. Hold on, let me write that down. Okay, I'll work on that. All right.
The other part, should I resubmit my picture assignments as a PDF? Would that make it easier?
If they're, the easiest things for me to open are JPEGs, Word files, and PDFs. Those are all, I open those without a problem. There are some photo formats that I just cannot open. The HEIM format, I have trouble with. iPhone can take picture like that. If you've submitted a JPEG or something, you know, if you have photos, you can just dump them in the Word document and send me a Word document. That's a really easy way to do it. You can also do that as a PDF. Those are the easiest documents to open for us because we have Microsoft Word stuff. PDFs are, you know, because PDF, they give their software away for free. Those are always easy to open too. And I'm kind of required to use PDFs because the ADA Act, those PDFs are very easy for screen readers to use. So, okay. All right, well, this might be it. So let's talk about the things we're going to talk about, and we'll see how it goes. First of all, let me go to grading stuff, things like that. Okay, so in the first box, there's the grades and policy handouts, and in the bottom, there's this grading thing. We're not going to have the second lab exam. Okay, we're just going to go with quizzes. The worksheets here, I've got them listed as assignments. There'll be some extra assignment points because we won't have the second lab exam. We have lots of Moodle quizzes, and we also have the final exam coming up. The final exam is 150 points, so it's more than the regular exam. Whoops, what happened here? Where did I go? I lost things. Uh-oh. Okay, hold on, let me try that again. Somehow I lost something. Okay. Can you see the grading sheet again? Thumbs up, yes, no?
Yes.
Okay, thank you. Okay, so the grading sheet, there's a final exam coming up. I've reopened the quizzes, the Moodle chapter quizzes. So if there's one you've missed, you can go back and do that. Or if there's one that you think I can do better, you can go back. Those are open. You can take those again as many times as you want. And we will have the final exam coming up. Those chapter quizzes will be open till December 5th. So that's kind of where we're at there. Okay. So does anybody have any questions about grading types, grading scales? It'll be a point scale. There won't be 1,000 points. There'll be 900 something. Okay. Okay, so let me see how that goes. Let me close that. Let's try another sharing. Let's look at our schedule and see if we can see what's going on there. No. Hold on. Nope, that's not it. Okay, well, let's just go to let's go to a PowerPoint and look at some PowerPoint stuff. I want some brain things. Okay, so we're talking about the neurological system. Do you see the brain slide? Anyone? Yes? Maybe?
Yes.
I can see that.
Okay. All right. So we're talking about brains, and these are the large regions, the brainstem, the cerebellum, the diencephalon with the thalamus and the hypothalamus, and then the cerebrum with its two hemispheres and all those lobes. And so we're going through the neurological exam, and this is really trying to look at, particularly the mental status exam is looking at some of the functions here, and also the coordination and gait exam looks at some functions. These are crucial areas, and I talked a little bit about why we want to look at this. And this kind of has to do with the types of brain injuries and problems that happens with brains as we age. And so I want to talk a little bit about these. And the functions that are most likely to be disrupted are a bunch of functions that we can kind of call them integrated, in that they involve connections between more than one brain area. And so when we look at the brain, we see the cerebral cortex, and we have these maps of the cerebral cortex, and I tell you this happens in this area and this happens in another area. And there are these primary areas and there are association areas, but I really haven't talked about, there's a lot of white matter in the brain. And these white matters, these are myelinated axons. There's three types: association fibers that go from, maybe the frontal lobe to the temporal lobe, and they're generally on the same side of the brain, and they connect brain regions next to that are kind of close to one another. Then there are fibers that go through the commissure, the corpus callosum. They cross over to the other side of the brain, and so they allow us to connect, the two halves of the brain. And then there are projection fibers that go to areas lower down, and these things allow really complex functions to happen between the cerebrum and the diencephalon and the cerebellum and the brainstem. These integrated functions then are functions that are likely to be disturbed with neurological problems. They include things like sleep, memory, emotion, motor functions, sensation and perception, and language. And so brain injuries you know, we're looking at these functions to try and tell if, you know, if these connections are intact, if brain regions are intact, and if not, can we identify where the damage occurs, and because that can help us think, well, what can we do? And so the neurological exam, it's going to look at some of these things, and other things are things that we notice. You know, stroke victims commonly have language problems. They commonly have motor problems, but there's other types of problems as well. Again, I mentioned sleep. Insomnia is one of the most common problems, and there's different types of insomnia. There's transient, that can be related to stress or depression. There's environmental effects. There can also be acute and chronic sleep problems that are not transient. That they can develop from something else. Poor quality sleep is a really big health issue. Sleep apnea is one of the biggest risks for heart disease and early death. When we talk about insomnia, there are some things we can change, but other things that we can't. Often we look at things like trying to affect environmental and short-term environmental things. So we use cognitive behavioral therapy to get people to change the environment, to change their activity patterns in the evening, to change diet. There are things that people aren't aware of that cause insomnia. Certain types of um, um, well, things like diet and caffeine, things that contain caffeine or caffeine derivatives that cause problems, and lots of beverages and some other things. We know certain types of light cause a problem, and so particularly bright white and blue lights, which are like what you get from computer and phone use, cause problems. And then if we've exhausted the environmental things, we have to go to medications. But sometimes these are fairly severe. Another thing that's in the news occasionally you see is Parkinson's disease, and this is a really kind of interesting neurological problem that's associated with a decrease in the number of neurons in specific nuclei of the brain. And these nuclei are involved in controlling various functions. And in the case of Parkinson's disease, these are neurons in the substantia nigra, which is a central part of the brain, a midbrain portion where some of the nerve tracks that are carrying information from the cerebrum to the cerebellum that are involved in motor impulses are synapsing there. And these are a small number of neurons, several hundred. And if you lose some of them, you'll have difficulty with motor control. There'll be stiffnesses, tremor, difficulty initiating voluntary movement. But this will also involve changes in emotion as well, because this midbrain area kind of sits right in that limbic center area. And so it's a whole series of effects. And this kind of lack of neurons or loss of neurons occurs with aging, also occurs in several types of dementia. There's a Lewy body dementia that it's a loss of dopamine secreting neurons that's kind of similar to Parkinson's disease, but also produces kind of emotional changes and some cognitive changes, and is an aging. And the exact cause of it we don't know, but we know it's associated with aging, and we don't think it's genetic, we think it's environmental. Okay. Then I've mentioned that perhaps the biggest cause of neurological problems that we use the neurological exam for are related to cerebrovascular accidents or stroke. These are disruptions to the blood supply of the brain. Sometimes they're temporary, like when a clot partially forms blocking a small blood vessel. It can resolve on its own sometimes, but other times they don't resolve on their own. So it's a full-blown stroke. And sometimes these can be ruptures where a blood vessel ruptures and hemorrhages, bleeds into the brain. this disruption of the blood supply is really serious because neurons are really sensitive to oxygen loss. And so unless they have a steady supply of oxygen, they'll begin dying very quickly within 5 or 6 minutes. In the case where you have hemorrhage as well, there's also a problem with pressure. That pressure builds up inside the cranial cavity, and that can cause loss of neurons. So with stroke, we see typically lots of neurological problems. And these, depending on where the stroke is, these can be, they can completely run the gamut. These can be loss of sensation. They can be loss of motor control. So you may have numbness, you may have blindness, loss of hearing. You may have, this is particularly the case on one side, you can have weakness in muscles or inability to move muscles. If a stroke is on the left side of the brain, this can interrupt speech because the speech centers, both the Wernicke, the general interpretive area, and the motor speech area, Broca's area, are on the left side of the brain. And so that can, you can have trouble understanding speech or trouble speaking. You can have loss of balance, dizziness, headache, all of these things. With stroke, this is kind of like heart disease, where you have materials building up in the arteries that make it more likely that a blood clot will form. And so this is an age-related risk related to diet, physical activity, smoking. Those are big risk factors. And of course, with this, we want rapid diagnosis so that we can restore blood flow. And so that sometimes can be done with just medication. Other times we have to do surgery. Rapid treatment, rapid diagnosis and treatment is really important because your cells can die. But we can also, if rehabilitation is starting and persistent, we can regain functions after a stroke has occurred. But stroke is not restricted to people in their 70s and 80s. There'll be people that'll have transient ischemic attacks in their 30s and 40s. So it's
it is.
okay.
But it's not the same as not doing it. But it is growth, and you should be proud of it.
Okay, Lauren, I think you have
Sorry.
It's okay. All right. Then for me, a big thing was dementia. And I mentioned this in the programs. Dementia. There are changes as we age. We lose neurons. And so this is a common thing, and we should all kind of expect this to happen in people as they get older, in ourselves, in our parents, and our grandparents. Dementia can also be caused by substance abuse. Alcohol in particular is a cause of dementia, but drug abuse as well. And infections can cause dementia. They can cause changes, and any of these things together are in combination. And dementia doesn't, it doesn't necessarily come on very rapidly. It can be slow changes that occur, or it can come on pretty rapidly. And these changes can be in memory, they can be emotional changes, they can be in activity patterns, difficulty with coordination, balance. You get mood changes, anxiety and depression, and wandering. And so, for my dad, his last 10 years were really related. He had a lot of dementia-related problems, but he was still the person that he was when I knew him, and as growing up, and there was still part of him that was there. He had a dementia that's related, and I'll talk about his in a minute. The most common types of dementia is called Alzheimer's disease, and it's the accumulation of protein outside of cells in plaques. Protein is referred to as an amyloid protein, and this accumulation of proteins is associated with loss of cells, loss of neurons, and so some neurons will begin to die. And this seems to happen pretty early in memory areas in the temporal lobe. you get an overall shrinkage of brain, but more the greatest shrinkage you'll see is in temporal lobes and frontal lobe areas. And actually, if we go here, you can kind of see there's a normal brain cross section on top, and then you see the dementia affected brain on the bottom, and you see these big losses of neurons, particularly in the temporal lobe, kind of in the lower lateral regions there, and so that's really important. Just kind of, there's my dad. He passed away in 2015. He suffered from dementia for about 10, 11 years. And the first indications were really some personality changes. He was willing to take risks. And my dad, he was a really smart guy. He was a navigator in World War II. And if navigating in World War II was not an easy job. You used a slide rule and maps. There were no cell phone towers or GPS. It was really a mathematical problems that you had to solve. And then later he became a chemist specializing in spectrometry. So a very, very smart guy, but he developed Wernicke-Korsakoff syndrome. This is a kind of related to aging and alcohol abuse and poor diet. And so it's really develops from a vitamin B deficiency, and it involves memory changes. Particularly, he has anterograde memory changes, which means he couldn't form new memories. He could still remember lots of his old things he could remember, although they were sometimes confused. This is called confabulation, that he would put kind of memories and merge them together. And then there was some cognitive loss. He couldn't solve problems anymore. He had some changes in his frontal lobe that reduced his working memory. And so there were some issues there. But with treatment, he could still enjoy a lot of the things that he previously enjoyed. He just couldn't remember them over the long term. So he would ask me the same questions over and over again. He moved to Freeport after he had dementia so that we could help take care of him. And he really never knew that he lived in Freeport. It was just, I live here and I know where I'm going, but I don't know I don't know the name of this house or where it's at. And so he could form new procedural memories. He had new emotional memories, but the new explicit memories were hard for him. He didn't form them easily, and so he could never get that I worked at a college. That was a hard thing for him. Okay, so I wanted to go over dementia, talk about stroke, talk about other changes like Parkinson's disease. Those are age-related types of illnesses that are, where you probably diagnose that first with a neurological exam. And so this is all trying to get us to, thinking about, okay, here's the anatomy of the nervous system. This is how it functions, and this is how we interact with it when we have patients through the neurological exam. Okay, so next week is our last week of classes. I will start reviewing for the final. I'll have review materials posted on Monday, and then I'll talk about the final exam next week on Wednesday when we meet for our Zoom meeting. Again, I want to remind you that the chapter quizzes are open until December 5th. So if you've missed one, you can go back and redo that. If there are chapter quizzes where you think I can do a little bit better, you can go do that. And of course, that's an excellent way to study is to review those questions. And so that's a really good thing to do. We're getting ready for the final. There will be no second lab exam. Okay, you should be working on finishing up ETS from the dissections with the submitting the sheep brain dissection and the spinal cord dissection, the instructions for the cow eye dissection. That's maybe the one where you have to do the most cutting and is probably the most difficult, but it's kind of the most rewarding because you can see the inside of the eye. And so you reveal something that you just can't see any other way. So that those instructions are in your lab manual. There's a little guide on a PDF file, and then there's a video of me doing that. So make sure your name is in the chat so I know you were here. Does anybody have any questions?
Did you have the submission box for those sections that we have left to do?
The submissions are all there except for the I-1 that will open on Monday, and so that's there. I just put that stuff on the Moodle page yesterday. I think it went up there yesterday morning. Okay. All right. Have a good Thanksgiving. Try and keep strangers out of your house, even distant relatives. We're still in the middle of the pandemic. Even though they're talking about the vaccine, that's going to be months away for most of us. Although for some of us that work in healthcare, maybe it'll be faster. But we're still in a very dangerous situation. You know, and the worst is not necessarily over, because we could, if we're not careful now, it could get bad.
Are we getting graded for it today or no?
Today, well, I have a record of you, and so if you have missing other ones, I might just click in and stick you in somewhere else. So
Okay.
you may get your points in another spot. I do have a record of you. So as long as you put your name in there, okay?
Okay, and I have a question for the leg assignment. Mine was posted under like exam 3, and it's no longer there. So I don't know where I have to submit it.
Which assignment?
The leg assignment, the muscle for the leg assignment.
I think that was the week after exam 3. But that's not been removed. You just have to kind of sort through boxes.
Okay.
Yeah. It gets to be where I've got so much stuff open it takes me a while to find it. So sorry.
Okay. It's okay.
Okay. All right. Have a good Thanksgiving, and we'll see you next week. Okay. Bye.